Here's another Fitzgerald-Anderson RN NCLEX review tip. When you're looking at psychosocial questions, look for the 3 golden rules that apply. The first one is, you're not trying to solve their problems. And why do we try to solve their problems? Because if you solve their problems, you're not helping them. You're supposed to facilitate to help solve their problems. So don't look for answers that solve their problems. The second test-taking tip that's associated with this is look for answers that reflect in feelings and content. Feelings, content are always important in the psychosocial area. For example, if a client says in a situation, "Those people hate me," the 2 responses I look for consistently are, "It must be frightening to think that those people hate you." That's reflecting on the feelings. Or you can reflect on content by saying, "Who do you mean when you say those people hate you?" That's another golden rule, is to look for feelings and content responses. And the third golden rule is you want to keep the doors to communication open. And by looking for answers that allow the patient to respond, then you're able to keep the doors to communication open. If the patient can't say anything, or the response that they're going to come back with is very defensive, then that is not the correct answer. So the 3 golden rules for answering the psychosocial questions are what? They are: number 1, don't try to solve their problems. Number 2, look for answers that reflect on feelings or content. And number 3, keep the doors to communication open. Another tip from the Fitzgerald-Anderson NCLEX-RN review.